Malaria, which is one of the most deadly diseases in the world, has been eradicated in most countries. Nigeria remains one of the few countries to yet to have eradicated this deadly disease. To change the status quo, ACOMIN has made great strides to reduce the outbreak of malaria in many states in Nigeria, and they have organized their last media meeting of the year to update the public on the status quo, on what is to be done and what has been done. The civil society working on malaria, immunization and nutrition, ACOMIN Kwara State Chapter, has organized its last media meeting of the year. The media meeting is usually held twice a year, with the first being in May and the last in November. As part of the national efforts to handle the challenges of malaria in Nigeria, ACOMIN has also been re-engaged by Catholic Relief Services under the ongoing Global Fund Malaria Grant to continue implementing the civil society component, which has been ongoing from 2019. The grant is presently being implemented in the 13 GF-supported states, namely Kaduna, Kano, Katsina, Jigawa, Kwara, Niger, Taraba, Gombe, Yobe, Adamawa, Ogun, Osun, and Delta states. The project covers 8 local government areas in each state. The 8 selected local government areas in Kwara State include Asa, Edu, Ekiti, Ilorin South, Ilorin West, Ofa, Ukero, and Oyun.
Provision of free malaria test kits and medicines at some facilities.
While presenting the media brief from the last media meeting, ACOMIN State SPO, Mrs. Folake Isheyemi, recounted the efforts ACOMIN have implemented in the communities during the last 6 months with the support of the community and various philanthropists. She also highlighted the challenges ACOMIN faced and thereafter called on the government to increase funding and do more in assisting ACOMIN in eradicating malaria nationwide.
We were able to bridge the gap between communities and the facilities, and also we are always preaching sustainability, that a time is coming in which all these are donors, they may not be there, but the synergy that is between the community and the facility will go a long way to see that all our health systems in Nigeria, they are in good conditions. Sometimes when we go to communities, they will tell us, it's government thing now, it's government that built the facility, so government should do everything. And we have seen some communities, they will tell us they don't have money, so they cannot do anything, that they are poor. But what we normally tell them that they have children in diaspora. They are living in Lagos, abroad, all over, spread across the country. They can still get in touch with them. We have some of them, they have like descendant unions. They can still get in touch with their children to come and do something to the facility. While addressing journalists after the media meeting, the state coordinator of Kwara State ACOMIN, Mr. Femi Olatunbosun, affirmed that indeed ACOMIN has been committed to enhancing the health provisions in the hinterlands. He thereafter called on the government at all levels to exercise political and increase health funding, stating that funding is essential to adequate health.
We need more money to work, and that's why we are using this medium to bring you the media in, to help us advocate to the necessary appropriate authorities to please increase funding in fighting malaria in our society, at the AGA level, at the state level, and even at the federal level. Because one day, Global Fund will leave, and they will live up with our problem. Except the philanthropists, except the government takes responsibility to ensure that there are more funds to eliminate malaria or to reduce malaria in our society, because malaria kills faster than any other disease you can talk of.
In his goodwill message, the Permanent Secretary of Kwara State Ministry of Health, Dr. Abubakar Anyila, who was represented by Sambo Abdulateef, monitor and evaluation Kwara State's malaria immunization program, appreciated the group for all they've done so far and assured them that the ministry will continue to work together with the ACOMIN team. He also reiterated the ministry's readiness to continue to support the ACOMIN cause. Other stakeholders who graced the event include representatives from the Catholic Relief Services, the World Health Organization, community heads, health practitioners, as well as concerned individuals.
I therefore urge all of you that are here to adhere to the government policies and regulations anywhere we find ourselves as health workers, development partners, community and religious leaders, advocates.
Whether as an individual or group, promoting the health status of people, such a person is contributing vitally to the well-being of the humanity and that community. And I want to say that my people and people in and around Tanke and other places I've seen that a person from Adewola is citing, I really appreciate them, and we are cooperating with them, and we still want to cooperate more.
The stakeholders all encourage communities to join efforts with the government and not leave the task to the government alone, as the government cannot handle it all alone. Idea Abdulhakim, reporting for ANF TV.